We are streaming on my end.
Great. Thank you, Bridget. All right, we're going to go ahead and get started. Good morning, everyone. So our weekly briefing related to COVID from Hamilton County. Thank you for joining. This morning, we've got Hamilton County Health Commissioner Greg Kesterman, who has joined. Dr. Steve Davis, he's the president and CEO of Children's Hospital, is on the line. And Tim Ackerman, who's the assistant superintendent of business operations with the Educational Service Center here in Hamilton County. Tim, thank you for joining. So as you can tell, we're making our topic kids this morning because there's a lot going on in that space. And I think people are a little bit confused as to what's happening. So we're going to try to do our best to provide information. So, mostly talking about the COVID impact on kids, both in the hospitals and in schools and at home. So that is the focus of the briefing this morning. So without further ado, I'm going to go through the numbers as I always do. So positive cases as of yesterday afternoon stand at 167,931. The increase from last week is 16,918. Our hospitalizations are up to 5,138. The increase from last week is 91. And our death count is up to 1,714. We lost 30 people over the last week to COVID-19. So I was on a call yesterday with health professionals, with public health, and there was some talk about where we are as far as the trajectory of these numbers. And as you can tell, our numbers are still going up. And so we are, there was some talk about comparing us to Cleveland, to Columbus, here in Hamilton County, to try to get a comparative really, because as we all know, Cuyahoga started this trend with very high numbers of, early on. And then unfortunately, Columbus and Cincinnati followed suit. So Cleveland's numbers are actually starting to go down a little bit right now. Franklin County, Columbus, is plateauing, still in a danger zone, but plateauing. But Hamilton County, Cincinnati are still going up. And still going up significantly. So we've got a little ways to go here. So I do want to emphasize that we are certainly not out of the woods. And to put a finer point on it, as many of you know, I kind of try to keep track of the week to week differences and the increases in positive cases in Hamilton County. So just as kind of level setting this conversation, back in October, our numbers for positive cases week over week were around 2,000, 1,300. That was kind of the range that we were seeing. In November, we were over 1,000 week over week positive cases. In December, we went from 1,500 to 3,000 to over 4,000 pretty quickly for the week to week over week increases. And here in January, we've seen the most dramatic increases, where as of January 5th, we were about 11,000 week over week increases in positive cases. January 12th, we were at 13,000. And this week we're at like 17,000 positive cases week over week in Hamilton County. So just again, to put a finer point on the fact that we are not out of the woods and we are seeing a dramatic increase still in Hamilton County of positive cases. I'll let Greg, of course, expand on the impacts of that and what that means. And two other quick things. As I'm sure you've all heard, the federal government is making test kits, at-home test kits available by mail. And that portal opened up yesterday. I think it was supposed to launch today, but it launched a day early. I got on and signed up for my 4 free tests. It is easy, easy, easy. And I want to say, if I can do it in 3 minutes, then you all can do it in 2 minutes. So the site is www.covidtests.gov. And it could not be easier to sign up for these free tests. So I encourage everyone to do that. Also, I do want to note that, work continues here by way of distribution of masks and gloves and sanitizer to schools, to nonprofits, to businesses that need it through our emergency management agency. Nick Crosley has been doing this work for 2 years. So we, as many of you know, as a county, invested in a stockpile of all of the above, so that our first responders, our educators, our frontline workers would have access to what they needed to keep safe themselves and to keep others safe. And so I asked Nick for just a short paragraph on how things stand. And so this is what he provided. The county EMA offered masks to local public and private schools via the ESC, the Educational Service Center, which sent an email in the middle of last week. Since that time, we've received a total of 44 school orders, which resulted in 764,000 three-ply masks being sent out from the warehouse. This includes 300,000 masks for CPS alone. So they will be distributing these masks the week of January 24th. And so as you can see, the need continues with schools, nonprofits, businesses, and we are continuing to provide those resources for folks throughout the county. So I want to encourage people to utilize that access point to masks, in particular, sanitizer, gowns, gloves, all the rest of it. But the schools are seeing an increased need here, obviously, for masks. So do want to note that and thank Nick Crosley and the Emergency Management Agency team for continuing to do that work and push out those supplies. So with that, I am going to turn it over to Greg Kesterman, Hamilton County Health Commissioner.
Good morning, Commissioner, and thanks for having me today. I'll run through the numbers and the state of Hamilton County as it relates to COVID-19. So at this moment in time, Hamilton County has 167,000 cases, or another way to look at this is 40,000 active cases of COVID-19 within our community. This is up about 8,000 over just last week alone. And as many of you know, there is a lot of COVID out there. We all know people at this point that have had COVID-19. So I continue to ask the public to use as much caution as possible, wear that mask when you're out and about, social distance, and continue to consider less opportunity for spread by reducing your gatherings a little bit. As far as our 7-day case average, today we are at 2,207 cases per day. Obviously, this is the highest point really in our current COVID-19 pandemic. We will continue to monitor this. The last couple of days were just slightly lower than a couple of days marked on this table. The Ohio Department of Health once again sent out a press release and did have a little bit of a backlog due to the extreme number of cases. So that has caused a little bit of inflation over the last couple of days, and we'll continue to watch these numbers. As far as our reproductive value this morning, we are at 1.28 for Hamilton County and 1.24 for the region. And our percent positivity for the region is at 33.7%. I'll show on another slide. For Hamilton County, we are much closer to about closer to 30% at this time. As far as hospitalizations, Commissioner Driehaus alluded to this, we continue to see a significant impact on our hospital systems. This morning, we have 1,019 individuals within our region's hospitals, 191 people within the intensive care unit, and 148 individuals within our ventilator. Our systems are busy. We've heard last week during the briefing that the hospitals are taking unprecedented measures to ensure that there are rooms available for patients, but certainly COVID-19 is a main focus in all hospitals here in Hamilton County and in our region. As Commissioner Driehaus also said, we are continuing to see deaths as a result of this pandemic. Our average runs between 4 and 5 deaths per day over the last several weeks. Turning to the Centers for Disease Control map, our cases are at 2,182 cases per 100,000. Our percent positivity, as already mentioned, is about 30.93%, and the entire state of Ohio remains in a state of high transmission. So we have lots of cases all throughout Ohio. Be careful if you're traveling as well. Turning now to vaccinations, we are continuing to make progress at our clinics. As you know, Hamilton County Public Health operates a well-run clinic at the Board of Elections. This clinic invites anyone, any age, to come and get their first vaccine. If you're over the age of 5, we're welcoming people for their boosters if you're eligible. We still have all 3 vaccine types at our clinic. We have the Janssen or J&J vaccine, Moderna, and Pfizer. If you are nervous still and have not yet received a vaccine and just want to come and talk to a nurse or a clinician and learn more about COVID-19 and the vaccines and learn more, we would encourage you to take us up on that offer as well. We're happy to be there for you, just for information, or if you're ready to get your vaccine, we're ready. Where can you find other locations to get vaccinated as well as testing? Testandprotectcincy.com is a great website. It lists out and also shows geographically where test sites are in Hamilton County as well as vaccination sites. I know leading up into the new year, there was a difficulty finding testing. Right now, there is tons of availability for no-cost PCR testing, which is really the gold standard and probably the best test to get right now if you have any signs or symptoms that might make you think that you have COVID-19. This test is more accurate early in your symptom onset, and it's more accurate later in your symptoms or as you're starting to recover. It's better at detecting the Omicron variant. The other thing I'll mention is probably the most important thing that everyone should remember. If you're sick, we are really trying to message that you should keep sick at home. Our hospitals are busy, as you just heard me say. And if you have the flu, if you have a cold, we don't want somebody with underlying health conditions or an older resident in Hamilton County to get sick and end up needing hospital care. We just want you to keep sick at home. It's really the simplest thing we can do right now to keep our community healthy. Lastly, Commissioner Driehaus did share the federal government did roll out their at-home free test kits. It can be found at covidtests.gov. Super simple. Only took me about 2.5 minutes, Commissioner, to fill out the form.
You're a show off, Greg.
I tell you. But yeah, it was really easy. And I would encourage folks to get some tests, keep them at home for the moment you may feel like you need them. I will stop there and turn it back over to you.
All right, very good. Thank you. All right, we're going to turn it over to Dr. Steve Davis, again, President and CEO of Children's Hospital. And the reason Dr. Davis is on today is because we were on a call yesterday talking about the situation in the hospital systems in general. But Dr. Davis had some really interesting insight related to Children's Hospital and what's going on with our younger population and the impact of COVID. So I just thought it would be really important to hear from Dr. Davis this morning to give us that update. So thank you so much for joining.
Thank you for having me. This is an opportunity to let you know what's happening with kids. And, you know, when we look at the pandemic from the beginning, the employees at the Children's Hospital and at other hospitals have pretty much mimicked the community. So when there's a big spike in the community, all of our hospitals have seen large numbers of employees with COVID. Children's hospitals for the first couple of waves of the pandemic were less impacted in terms of hospitalization and significant disease than adults. We are seeing a bit of a difference with Omicron, and we are seeing a large number of kids be infected, similar to our adults. And we're now seeing many more children in the hospital with this wave than we've seen at any point in time during the pandemic. So when we look at it, just to put it in perspective, as Commissioner Driehaus gave you some numbers over time, if you look back just to the first week in December, we had fewer than 10 children in the hospital. Over the succeeding 6 weeks, that number has gone up every week. And for the last week, we've had over 60 children in the hospital. And when we talk to our colleagues at the other children's hospitals in the state, they are seeing similar numbers. And as you mentioned earlier, that wave was seen first in Cleveland, then in Columbus, and now here. And the Cuyahoga County area is an area I'm extremely familiar with. I spent 20 years at the Cleveland Clinic and was talking to some colleagues just yesterday afternoon, and they are starting to feel some relief, and it is noticeable. And for them, that is a good thing. And for us, we are hopeful that in Hamilton County, we experience that same rapid rise, which has already happened, a brief plateau, and then start to see it coming down. And, you know, people are resilient. Once they see that things are starting to get better, morale jumps up. And I've been talking to colleagues in Cleveland for the last few weeks, and they've gone from gloom and doom to they're actually now breathing a little easier. And I hope that we can say the same thing in a week or two in Hamilton County. Although, as Commissioner Kesterman pointed out, we haven't hit that peak yet, we don't think. And we're just hoping that it is a short one the way Cuyahoga County's experienced. So go ahead. Look like you had a question.
No, I didn't know if you were finished or if you had more information.
Well, one of the things that's always important to talk about with kids is the impact on schools. And we've been holding town halls and meeting with school leaders from the beginning. And, this has had a significant impact on kids' education and on their mental health. We're certainly seeing it in our emergency departments, our urgent care, and in our inpatient mental health facilities, that kids are stressed now more than ever. Being in school for them is actually a good thing. And, we were talking before we came on, I have 4 kids, and, most kids will tell you that they would love a snow day, they'd love to be off from school, but they really do want to be in school, and that is the best place for them. If we look at the risk to kids now in being in school versus being in home, we think that the balance of risk is better off for them being in school. Obviously, we want everybody 5 and over to be vaccinated and everyone 12 and over to be boosted. We want everybody to be wearing masks indoors, and we want schools to do as good a job as they possibly can on spacing kids. But we do think there's significant benefit for kids to be in school and for us to take those kinds of precautions that Commissioner Kesterman has been saying all along. We've been saying, wear your mask. And, one of the things that we get lots of questions about is the different kinds of masks. And first is, any mask is generally better than no mask. A hospital type mask is better than a cloth mask. A well-fitting mask is the best thing that you can look for. And we get lots of questions about N95 masks. And one of the challenges with them is that they really do require fit testing. So we encourage you to wear the masks that are available to you that are well-fitting, and avoid crowds and get your vaccines. And those are the kinds of things that we've been saying all along. We're really pushing them now here at Children's because we are being impacted more and our kids are being impacted more. So we do need everybody's help to keep our kids safe and in school. We know it's best for them in the long run to be in school. And I'll stop there and obviously be happy to answer any questions as time allows.
Thank you so much, Dr. Davis. Really appreciate it. All right, perfect segue to go to Tim Ackerman, again, Assistant Superintendent of Business Operations at the ESC. Welcome, Tim.
Hi, Denise. Thanks for having me. I appreciate it. First of all, thank you to Children's Hospital, for Steve, and also Commissioner Kesterman. They've been great partners with all of our school districts through this pandemic, and we really appreciate everything that they've done. We've seen a lot of positive cases for staff and students in our schools since the holiday break. And as all of you know, there's an extreme shortage of substitutes, not only for teachers, but for bus drivers, mechanics, food service, you name it. There's an extreme shortage right now in the area. Our rate of absences, we've seen almost double with our school population since the holiday break. In fact, we've had a 40% sub request are not filled each day. And so you can imagine we've seen the amount of staff absences double, and then 40% of those cannot be covered. And I think that's why you're starting to see school districts go on small breaks to try to recover from that. Also, one of the main issues that school districts are facing is contact tracing. And we've worked closely with Greg on this as well. Just to imagine a school district, you have one positive case at a high school. That high school student is in 7 different periods, plus lunch, plus possibly the bus. You're contact tracing for one positive student close to 50 or more other students that you have to contact trace for. So you can imagine that and what's happening in schools with that happening as well. Also, parents have been inundated with emails daily on positive cases from schools. So with that, Denise, I'd be happy to answer any questions as well.
Okay, thank you. Really appreciate it. And I know we have questions already lined up. So with that, Bridget, I'm going to turn it over to you to facilitate.
Okay. First up, we have Larry Seward from WCPL. Larry, you'll just take a second to come on over as panelist.
Good morning, Larry.
Good morning, commissioners and Dr. and Tim. Nice to see you guys Took me less than 2 minutes though to get my COVID test, I think, from the Fed. So
Oh, again, bragging.
yeah,
Not a good look, Larry.
yeah, well, Dr. Davis, the number you cited, I think 60 kids in your hospital a day. Is there a number or statistical measure that supports what you're talking about, that the number of kids coming through your system is comparable to adults? Because 60 doesn't sound like it's comparable to the number of cases that we're hearing for adults.
So if you look around the regional hospitals, there are anywhere from 100 to 250 adults in each of our regional hospitals. And as Commissioner Kesterman pointed out, there are about 1,000 patients in the hospital today. And if you look at the population of kids versus the population of adults, it's pretty similar. Now, we didn't see anywhere near this surge early on. And when we were reporting on the hospital steering committee, we'd have 2, 3, 4, 6 cases when our adult hospitals would be reporting in the hundreds. Our number has really gone up 8-fold since early December. So this wave is different in its impact on kids.
Is there something that you've learned from your colleagues in Cleveland, perhaps a telltale sign that we're peaking or plateauing, or strategies that they used that might help the hospitals here?
So a couple things. The strategies haven't changed. Get vaccinated, get boosted, wear your mask, avoid large crowds. If you're sick, stay home. And if you know of someone who's ill, try to, keep distance. In terms of what I've learned from colleagues in Cleveland on the timing of it, no, we're hopeful that we experience that same just short high plateau and then a nice decline. It's too early to tell, but I think we're cautiously optimistic that the path will be similar to what we've seen in Cleveland. The other thing I would add is that what we've seen in Cleveland, in Franklin County, and here in Hamilton County is that the vaccines remain highly effective at reducing hospitalizations and severe disease. The state has a vaccine website available, and it shows each week the percentage of hospitalized patients in the state who are fully vaccinated, and that number is averaging just under 5% for since the vaccines have been available. And the last month or so, it's still been around 4 to 5%. So the vaccines continue to be our best way of protecting ourselves and those that are around us.
The contact tracing that Tim mentioned, this question is for Tim and for you as well, Greg. The challenges with that, are school districts having issues with having enough people to do that? Are they having to bring in outside folks? Is that something that is overwhelming the county, Greg?
Yeah, so in general, contact tracing is a lot of work. And as Tim indicated, in a school system where a high school child moves from school or from class to class and is on a bus, it can really add up quickly. So we are working closely to help see what the state can do to eliminate some of the requirements for contact tracing in schools, as well as some of the reporting requirements. It's important for parents to know what's happening in the school, but we also want to make sure that those folks that are assigned to contact tracing are able to help out as substitutes and other jobs within the school building.
Yeah, so Larry, to add on to that, a lot of school districts have added personnel in the beginning of the year to contact trace. But as Greg mentioned, mainly those are nurses that were hired. But if you have a nurse that's out in another school, that nurse sometimes has to go cover in that school and can't contact trace. So then you have administrators contact tracing, and they can't because they're covering classes for teachers that don't have substitutes. So it's just it's an endless domino effect.
Thank you, Larry.
Next up, we have Brooks Sutherland with the Inquirer.
Good morning, Brooks.
Good morning, folks. How are we doing?
Good.
Dr. Davis, you touched on this already, but I want to pin you down specifically on Cincinnati Public Schools. They're going to return next week. That'll be 36,000 kids. Is the timing right, given some of the challenges that you referenced with the hospital, or do you think it's too soon?
I actually think the timing is right for them to be back in schools. It's a challenge for kids not to be in school, and they've been really impacted throughout this time period. I do think that we need to just continue to as boring as it may sound, continue to emphasize the basics. Get every kid 5 and over vaccinated if possible. Get every kid 12 and over boosted. Have everybody wear masks indoors. And then I would say the balance of risk is better for them to be in school than it is for them to not.
Thank you. And Commissioner Kesterman, I wanted to ask you, we're hearing, Cleveland being down, Franklin plateauing, Cincinnati still going up. We've added testing in the area. The National Guard is here. We just had I would say a big gathering of people last weekend. Is it safe to say, given some of those factors, that we're still a few weeks from reaching our peak?
What we have seen with the Omicron is it spreads much quicker than any of the other variants. So I would start to think that we would see some cases. Obviously, folks in indoor bar environments were at higher risk than individuals celebrating outside. We know that's how COVID has worked throughout the pandemic, but certainly we will see some cases associated with the gatherings of last weekend associated with the Bengals game.
Thanks.
Thank you.
We have Allison Batka with City Beat.
Good morning, Allison.
Morning, everybody. Dr. Davis, I wanted to talk a little bit about these cases and children that you're seeing. Can you kind of give a reason of why we're seeing such a bigger spike? Like, lay it out for me like I'm a 4-year-old. Is it because of more schools and more families not doing all these other mitigation things, like masking and whatnot? Or is it because Omicron is that much worse?
So I wouldn't say Omicron is that much worse. I would say Omicron is that much more infectious. It spreads very rapidly from person to person. It's probably too early to know the long-term implications of Omicron versus some of the other variants. But what we do know is that it probably spreads much more quickly. The cases tend to be less serious, but because such a large number of people are getting infected, and there are many who are at risk from having other chronic diseases, that we are still seeing large numbers of hospitalizations and deaths. When you look at kids were the last group to get vaccinated. So there, it was over 18, then it was 12 to 18-year-olds, and now we're vaccinating 5 and above. Many families with young kids that are school-aged also have kids who are under that 5-year age. So they're in houses with kids who are not vaccinated, even if the parents and the older kids are. So there's certainly risk there. It's harder for small children to keep masks on, but we're not seeing anything that's different specific to kids about this virus than we are in adults. It's very, very infectious, moving quickly across people, and that's why I think we're seeing more kids in the hospital.
And specifically, are you seeing the kids that you're seeing, are they generally the unvaccinated kids, or are they kids who have already been vaccinated?
Similar to adults, the vast majority of our patients who are of age to be vaccinated The vast majority of our patients who are in the hospital are unvaccinated, whether that's because they're not old enough or they haven't their parents haven't gotten them vaccinated. But we really aren't seeing a large number of kids or adults in the hospital with serious disease who have been vaccinated, which is why I keep repeating, everyone needs to get vaccinated and boosted. That's the best thing that we can do for ourselves and the community.
Got it. Thank you.
Thanks, Allison.
We have Madeline Ottilie from WCPO.
Hi, Madeline.
Hi, thank you all so much for taking the time to answer our questions today. The Biden administration is expected to distribute hundreds of millions of free N95 masks to pharmacies and community health centers. I'm wondering if you have received any information on how distribution could work in Hamilton County, and if you could elaborate on the impact a program like this could have.
Greg, I'm going to let you answer that one.
Sure. I actually don't have any additional insight on it, although to echo Dr. Davis's comments, the Centers for Disease Control is really recommending people wear the best mask available to you that you're willing to wear as often as possible. So we're really, if you're uncomfortable in an N95, that's probably not the right mask. If you're comfortable in a cloth mask and you're willing to wear it all the time, then that probably is the right mask for you. As Dr. Davis indicated, the standard surgical mask that you might see somebody in a doctor's office wear, that is an effective mask that is typically comfortable and provides even greater protection than a cloth mask. So I would really just encourage folks, if you're heading out to the grocery store, if you're heading to a Bengals gathering next weekend, please wear a mask as often as possible to help protect those around you.
Thank you.
Thanks, Madeline.
We have one write-in question from Fox 19. Jennifer Baker asks, what's the impact of Hamilton County's COVID case numbers from the crowd at Paul Brown Stadium for Bengals playoff game on Saturday, at bars, at parties, or is it too early to tell on the numbers?
In general, as kind of mentioned earlier, from the weekend, it's probably a little bit early to tell. We would anticipate there being some impact anytime you see gatherings of any kind, particularly when this virus is spreading as it is right now. We would anticipate some individuals getting sick, but we don't know what that impact is yet.
And that seems to conclude our questions from reporters.
All right, very good. Well, thank you again to Greg Kesterman, to Dr. Steve Davis, and to Tim Ackerman for being on this morning to talk about kids and all things related to COVID and, of course, the impending Bengals game. We hope to have more Bengals games that people will celebrate here. But, as always, the message is celebrate safe, get vaccinated, put the mask on if you're around people in large groups, stay home if you're sick. I mean, Greg, these are the messages that have been the messages sent for 2 years, but we want people to just celebrate safely so that we remain as safe as possible in this community. So again, thank you all for being on, and we'll be back next week.